Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 725,495 confirmed cases of COVID-19 in Canada and 244,932 cases in Ontario. Chatham-Kent has 1,039 cases, and Sarnia-Lambton has reported 1,685 cases. Michigan now has 542,146 cases, with 27,890 cases being in Detroit. Today we are reporting 101 new cases of COVID-19 in Windsor and Essex County. 11 cases are close contacts of confirmed cases, 18 are related to outbreaks, and 72 are still being investigated. We have had 11,447 cases since March. 8,951 cases are now resolved, and 2,216 people are active cases at this time. 110 confirmed cases are currently in the hospital, and 16 people are in ICU. A further 167 suspect cases of COVID-19 are in the hospital. We are reporting an additional 3 deaths today, all women living in long-term care and retirement homes. 1 woman was in her 70s, 1 woman was in her 80s, and 1 woman was in her 90s. Our community has lost 280 people to COVID. 189 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 49 active outbreaks in Windsor and Essex County. 23 are in workplaces, 19 are in long-term care and retirement homes. There are 5 outbreaks in our hospitals and 2 community outbreaks. We currently have 11 outbreaks in the agri-farm sector, with 57 active cases. 255 people have now resolved. 104 people are isolating in the hotel. As with all of the farms, our public health inspectors work directly with the farm operators to manage the outbreak. Today we will be working with our final retirement home to vaccinate residents. So in the past 3 weeks, our staff, hospital partners, and long-term care and retirement home staff have worked with every long-term care and retirement home to vaccinate residents, staff, and essential caregivers in Windsor-Essex. We will continue to monitor our vaccine supply closely. Despite the rollout of vaccine, please continue to follow public health measures. Stay home if you're sick, limit your close contacts to your household members only, maintain a 2-meter distance from others, wash your hands with soap and water or use an alcohol-based hand sanitizer, wear a non-medical mask or face covering, cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze, and download the COVID Exposure Alert app at canada.ca. If you have any symptoms of COVID-19, no matter how mild, please get tested by calling or booking an appointment online at one of the testing and assessment centers. Common symptoms include fever, new or worsening cough, barking cough, and chills. The testing and assessment centers are able to accommodate same-day testing at this time. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us again. We continue to see deaths related to COVID-19 in our region, and my thoughts and prayers are with the families who lost their loved ones to this pandemic. So far, 280 lives were lost in our region due to COVID. 110 cases are currently hospitalized and 16 people are in ICU, and their loved ones praying for their health are the consequences that all of us in the healthcare system are trying to prevent and have been doing that for almost a year now. All these consequences that we are observing right now is a lagging indicator for what happened a few weeks ago or about a month ago. We had widespread community transmission and our case count increased at a rapid rate, and as a consequence, now we are seeing the increased burden of all these cases in our hospitals and people dying. That is why it is important to understand the importance of taking action early before we get to the point of increased hospitalization and our people dying. We are making progress now, little by little, with respect to the number of daily cases. a slight improvement. We have seen significant fluctuations in the last week, but the 7-day moving average is also showing a slight improvement of cases in COVID in our region. We will share the full epidemiological summary tomorrow. We are also making progress in the vaccine front by protecting the most vulnerable in our community. We have done it for the most part by vaccinating most of our residents in long-term care home and almost all of our retirement home. The unfortunate news yesterday with the reduction in Pfizer vaccine supply will bring a hiccup in the overall vaccine rollout in the region, but Windsor-Essex is probably ahead of all the regions in the province to vaccinate most of the residents in these facilities. As we receive more vaccine, we will continue to protect our most vulnerable in the region and save lives. That is the most important mission on our hand, save lives. As always, please continue to follow the public health measures to keep everyone safe around you and keep our community safe. Thank you.
We'll now take questions from the media. Today we'll start with CBC.
Hi, good morning. I'm wondering if there's any update on the new COVID-19 variant. Do we have any evidence that it's been found locally or suspected?
So far, I haven't heard anything from our lab. The lab at the Public Health Ontario lab in Toronto, they randomly check some of these specimens from different regions, and especially if they're seeing any significant pattern of outbreak in one sector. They do that testing. All of these testing takes time, sometimes days to weeks to run those specimen analysis. So far, we haven't we're notified that they have found something unusual in our region.
Okay, thank you. I also wanted to ask about agri-farm outbreaks. Do you have any additional information to share about what's happening and, how many cases, what's the extent of the current outbreaks?
So I think Teresa just mentioned some of those numbers, and I'll have Teresa maybe just repeat that answer again.
So we do have 11 outbreaks in farms right now, and overall we've had 255 active cases, or like confirmed cases. And right now, though, as we're progressing through working to resolve the cases, there are 57 active cases. 104 workers are in the isolating in hotels right now.
Sorry about that, I missed a second there. Thank you.
Any questions from Blackburn?
No, thank you.
Any questions from the Windsor Star?
Not right now, thank you.
AMA 100?
Dr. Ahmed, just looking ahead, have you and the team talked to the ministry once the state of emergency is lifted and the gray zone is lifted? Is there plans in place right now where we go back to the red zone, orange zone? Has that been discussed at all?
Not at this point. I think what happens, as you all know, when province move any of the region into a higher restriction zone, they like to see data, at least 2 to 3 weeks worth of data before any decision has been made. Right now, at the provincial level, they have implemented the stay-at-home order for the 28 days by the Premier's office, which is coming close to an end. And once we get to that part, the conversation about bringing some of these regions back, I think that would happen. I haven't been into that discussion yet. I anticipate next week would be a time when we will have more of this discussion with the province.
Okay, thank you.
Any questions from CTV?
Yes, good morning. You'd mentioned progress, and we can see it in our numbers declining. Are you hopeful that you can finally see the light at the end of the tunnel and maybe even dip down to double-digit numbers next week instead of the skyrocketing cases that we have been seeing?
Well, as I said, we are making progress little by little, and I am hopeful, I am optimistic. And every day when we're waiting for these numbers for our EPI team to compile this number, I am optimistic every day, and I truly like to see those numbers going down to double digits and finally going down to single digits. I think that's the hope, and again, this progress that we have made, it is the effort of everyone coming together and doing their part in preventing the spread of the disease. We like to see that continue, and I think that's the critical message that we want everyone to understand, that it's not the point that now things are better, we can go back to what we are doing, minus the fact that right now we're not allowed to meet anyone, but when it comes to following the public health guidance, public health measures, that is critical. We have to do it. Doesn't matter whether if someone is vaccinated, whether someone is an essential worker or whoever they are. We all have to do our part to make sure that we are still doing everything that we have been asked to. Once we start to see some changes in our local epidemiology, there may be a lifting of some of these restrictions that is currently in place, but we can only keep the case going down and keep it that way by following those recommendations. So while I would welcome any progress that we are making, we also don't want to lose sight and give a wrong message that things are getting better and we don't need to follow those. I think it's more than ever important to understand the value and importance of following those measures. These measures work, that's why we're seeing a decline, and we should continue to see that decline when people follow these measures.
Okay, thank you.
Any further questions from CBC?
Thank you.
Blackburn?
No, thanks.
Windsor Star?
No, thank you.
AMA 100?
Just a quick one for Teresa. Teresa, I know most of the businesses are doing curbside right now, but is the team still out there? Has any additional charges been handed down by the health unit lately?
I'll give an update on that tomorrow because I did receive a report, but I hadn't opened it. I know they are still out there. They all are still working, and there is more work that's happening regarding the compliance and making sure people are adhering to the rules. So I'll do an overview of the information and get back to you tomorrow.
Sounds good, thank you.
And any further questions from CTV?
No, thank you.
Thank you, everyone.